Hi guys, it's Dr. Qureshi here. I am going to talk about the trauma case that I was mentioning in my last video and also on my Facebook page, on the public page. So it's a fishhook injury that I keep telling you about because, like I said, in Louisiana, a lot of patients and a lot of people, like the locals, love to go for fishing. It's a great sport. They got me into it a little bit, I would say, because I caught my first fish at a pond, a local pond here. So it was quite an interesting and exciting a little thing for me, but of course I was protecting my eyes with sunglasses because I'm going to tell you about this patient that I saw. He is in his mid-20s. I found the picture for his before and after the injury shots, so I'm going to show them to you in just a little bit. So he came in because he goes fishing, right? And he goes to the ocean, he goes to the bayou, he does all kinds of takes all kinds of fishing trips. So he wasn't wearing his not safety glasses, but like sunglasses are also protective for the eyes. Obviously, he wasn't wearing them, and he came in because the ER sent him to me. He had a fish hook in the eyeball, and I'm going to show you a picture of that, and then I'm going to talk to you about the case also. So if you look here, this is his eye. This is how he came in, and you can see that there is this fish hook right into his lid right there. So he was in severe excruciating pain, and the ER did remove this the hook from his eye, and I was concerned because his vision was decreased from 20/20 in the other eye, which is his good eye, this one. This is his right eye, this is his left eye. So you can see there was some bleeding going on here, and you can see from the expression he is in excruciating pain. So the ER did remove the hook, and then I saw him one day after, so that's what it looked like. So this was a much better looking eye. He was still in a lot of pain, and his vision was still from 20/20 to 2200. So at that time, this is his eyeball, so you can see the bruising, the contusion. In the cornea, you can see here, you can see there was I didn't see any abrasion in the cornea, at least. But then he has subconjunctival hemorrhage, which is in the conch, in the white part of the eye. The lower lid looked fine, but the upper lid, you can see some swelling. At this time, for any kind of traumatic injuries, you have to make sure there's no traumatic cataract developing, no traumatic glaucoma, no lens dislocation. So I checked him, dilated his eye. I didn't see anything at that time. Now I'm going to talk a little bit about some of the stuff that I have to refer these cases for. So the first thing that you have to keep in mind is look at his retina, like I mentioned that in the previous video also for the other trauma case where the patient had all the edema and the swelling because he hit his head on his car. But in this situation, I wanted to make sure there was no retinal complication. Now, a lot of times patients will come and you will be thinking about retinal detachments in this kind of cases, because why else did his vision get so much worse, right? But in his case, when I checked his retina, I did not see any retinal detachments, no retinal breaks, holes or tears. However, there was some vitreous hemorrhage that I saw, okay? So I was concerned about that, and I wanted to make sure the macula looked good, so we did his macular OCT. I'm going to show you a picture of his macular OCT, which is way in the back of the eye, and it checks all the layers of the retina, all the 9 layers. I'm going to show you what I saw in that. So I had to refer him to a retina specialist, and I also saw some kind of chorioretinal, not detachments, but some kind of like some areas that were looking like folds almost. So let's talk about that as well, and I'm going to show you that picture. So this is obviously the eyeball after the fish hook was removed from his eye. He was lucky because it didn't go in directly into his cornea. It was more in this lid area, but it was a blunt trauma. So first, let's look at his macula. So as you can see, and I've showed you so many pictures of macula in so many different cases, so you can appreciate what a macula looks like at this stage. This is his left eye, this is the right eye, and if I make it bigger, let me see if I can make it bigger. Okay, so there. So you can see this is the area where I saw a little bit of intraretinal hemorrhage in that area, but then this part looks fine. So I had to refer him to a retina specialist. Also, before I show you what the retina specialist did for him, this is what his eyeball looked like. So let me make this bigger again. Let's make this even bigger. So you have been seeing all these fundus photos. So this is our fundus camera, the Optimam, and it takes a very, very good picture. You can see in detail what the retina is looking like. So this is his optic nerve. Now let's discuss this area. This is where the macula is. So I was more concerned about the macula, like what if he has some vitreomacular traction. But you see this area here, this is where all the vitreous hemorrhage was happening. And then you see the choroid, which is almost like green in color because that's one of the layers of the retina. So there's sclera on the outer part of the eye, then there's choroid, which is middle part, and the retina is the innermost part. So whatever area you're seeing which is greenish, that's coming from the choroid. So he did have a little bit of a damage to the retina and to the choroid because of the blunt trauma, and there's definitely some vitreous hemorrhage. But then it was also kind of, you see these folds here, they were kind of affecting the macula in this area as well. And then the optic nerve looks fine. I did not see any complications there. So what I did was I sent him to the retina specialist, and Dr. Robert Blum is the retina specialist who works with this. He's, like I've mentioned in other videos, he's like one of the best retina specialists we have in town. And he actually called me and said that this patient had a condition known as scleropteria. Okay, so it's got a little bit different condition. So scleropteria is when the retina is intact, so there's no retinal detachment. However, there is chorioretinal separation. Okay, so there's like a tear, and that leads to the vitreous hemorrhage. But it's not a real retinal detachment, and that's why it's known as the scleropteria. And this condition happens a lot of times in blunt trauma cases, right? So it's going to be high velocity blunt trauma impact in the eye, and this patient obviously fits that criteria because, again, it was blunt trauma, it was high velocity. Because when you do the fishing, you throw that fishing rod into the water, and then once you get the fish and you take it back, you're pulling it back, that's the velocity, because it can go really fast, you know. So that's what it was. So what we did in this situation was I sent him with some oral steroids, and then I did topical steroids, and I also did antibiotic. And Robert Blum, Dr. Blum, the retina specialist, also agreed with all of that, and he kept him on that treatment plan. And then obviously after some days, after few days and few weeks, he was seen by him again. So this is what the blunt trauma can do. And again, I always tell my patients, especially in Louisiana, because they go fishing all the time, to make sure you're protecting your eyes. And sometimes the patients have been joking with me, and they say, well, you went fishing because we sent you, you know, because I'm trying different sports here. It's always fun to try new challenging things, and that's what makes life interesting, right? So they say, hey, did you wear your safety glasses? Did you wear your sunglasses? And just so you all know, I always protect my eyes, even if I go running, jogging, if I'm in the sun, or especially for these kind of activities, you have to protect your eyes. Okay, so we'll discuss some other cases in the future, but just be safe, be healthy. Goodbye.